Welcome. Today, we're diving into the world of environmental monitoring and quality risk management with Dr. S.K. Singh. We'll explore key strategies and insights that help keep our environment safe and ensure quality standards are met. Let's get started. Let's start with the basics. What is environmental monitoring? It's a documented program that helps us keep contamination in check within clean rooms and controlled spaces. We track two main types of parameters. First, viable monitoring, that's airborne and surface microorganisms, plus any contamination from personnel. Then, non-viable monitoring, things like particle counts, pressure differences, temperature, and humidity. The goal here is clear: to prove we're maintaining control and that our contamination strategy is working effectively. Let's talk about regulatory expectations, the rules that guide how we manage quality and risk. The EU GMP Annex 1 calls for a risk-based environmental monitoring program. That means we don't just collect data, we analyze trends, investigate any excursions, and integrate findings with our contamination control strategy. Meanwhile, ICH Q9 outlines a clear risk management process, from identifying risks, analyzing and evaluating them, to controlling and reviewing those risks over time. The key principle here is that all monitoring must be backed by solid scientific reasoning and risk management. Let's look at a typical environmental monitoring program in a grade A aseptic filling area. It includes continuous particle monitoring and active air sampling to keep the air clean. We also monitor personnel after operations, checking gloves and gown surfaces. Surface monitoring uses contact plates and swab samples. Plus, we track physical parameters like particle counts, humidity, temperature, and pressure differentials. Together, these elements help ensure a sterile environment, protecting product quality and patient safety. Let's walk through the quality risk management process following the ICH Q9 life cycle. First, we identify risks, asking, what can go wrong? Next, we analyze those risks to understand how severe the impact might be. Then, we evaluate whether the risk is acceptable or if action is needed. After that, we control the risk by figuring out how to reduce it. Finally, we review to see if our controls are working effectively. For example, repeated microbial issues in a filling area would prompt a risk assessment and corrective actions. Here, we're looking at how to assess risk using the Risk Priority Number, or RPN. It's calculated by multiplying three factors: severity, occurrence, and detection. In this example, severity scores a 5, occurrence a 4, and detection a 3, giving us an RPN of 60. That puts us in the medium to high risk category, a level that definitely calls for mitigation. This approach, called failure mode and effects analysis, helps us prioritize where to focus our efforts, like addressing a high microbial count in a grade B area. Let's look at how we calculate average colony forming units, or CFU, in the air. We add up the daily counts, 5, 7, 4, 6, and 8, then divide by 5 days. That gives us an average of 6 CFU per cubic meter. This number sits well below the action limit of 50 CFU per cubic meter. But even though we're within limits, the upward trend over these days suggests we should keep a close eye on potential contamination risks in this grade C area. We saw a 267% increase over just 4 months. That's significant. Even though no action limits were exceeded, it triggered a risk review. Looking at the monthly average colony forming units, or CFUs, we tracked a steady rise from January through April. This shows why trend analysis matters. A single result might not tell the full story, but trends reveal emerging contamination, seasonal changes, equipment wear, or cleaning issues. It's about spotting patterns before they become problems. When we talk about a risk-based response, it really depends on a few key factors, like the type of product, how much of the batch is exposed, and where we are in the processing stage. Managing alert and action levels is crucial here. An alert level signals a possible negative trend, while an action level means conditions are unacceptable and need immediate attention. For example, in grade C air monitoring, if the alert limit is 25 CFU per cubic meter and the action limit is 50, An observed result of 35 triggers an alert investigation and increased monitoring, but no product impact. Let's walk through a real example of investigation and corrective action. We noticed a microbial count in a grade B area that was just above the action limit, 55 instead of 50 CFU per cubic meter. Digging deeper, the root cause was a leaking HEPA filter and reduced airflow velocity. So, the corrective actions included replacing the HEPA filter and rebalancing airflow. On the preventive side, we enhanced maintenance and added more rigorous filter integrity testing. The result: environmental monitoring levels returned to baseline, problem solved. Let's talk about the benefits of a risk-based environmental monitoring strategy. It helps us use resources more efficiently, focusing effort where it matters most. It also improves contamination control, which protects the product and ensures we meet strict regulatory standards. The table shows how monitoring frequency changes with risk level. For example, grade A areas, which are critical, require continuous monitoring. Lower risk areas, like grade D, are checked periodically. This approach aligns with the latest EU GMP Annex 1 guidelines, making our processes smarter and safer. Let's talk about the key lessons we've learned. Environmental monitoring isn't just about collecting data. It provides solid evidence that our environment is under control. Quality risk management takes that data and turns it into smart, proactive decisions. When we combine these approaches, we get early contamination detection, lower product risks, better regulatory compliance, and ultimately, safer patients. Regulators expect a risk-based monitoring program, integrated with contamination control, ongoing trend analysis, thorough investigations, effective corrective actions, regular risk reviews, and strict data integrity. This is how we keep quality front and center. Environmental monitoring and quality risk management work hand in hand as essential pillars in modern pharmaceutical quality systems. Together, they create a scientific, risk-based framework that helps us spot contamination trends early, evaluate their impact on products, and put effective controls in place. This approach keeps us aligned with key regulations like EU GMP Annex 1 and FDA CGMP. By integrating these two, we're able to maintain a controlled environment, make informed decisions, and continuously improve product quality and patient safety. That brings us to the end. For any further support or questions, please don't hesitate to reach out. Thank you for your time and attention. It's been a pleasure sharing this with you. This video was created with SlideSpeak. Visit SlideSpeak to turn your presentations into engaging AI-narrated videos.